Like all surgery, hip surgery has risks, but there may be some important differences between the risks for hip fracture surgery versus total hip replacement. I'm Rochelle Grossman with your latest health news. A new study compared patients and found that those with hip fractures tended to be older, have other medical conditions, and were at a higher risk of death. When a patient breaks a hip, surgery is usually needed to help the fracture heal. In a total hip replacement, the damaged bone is removed and the hip joint is replaced by a prosthesis. Previous research found that patients undergoing a total hip replacement are generally younger and healthier. Their risk of death was only 0.3%, while the risk of death for people undergoing hip fracture surgery was 1.8%. In addition, patients having hip fracture surgery were much more likely to be admitted to the intensive care unit. Experts say that because a hip fracture may cause pain, bleeding, and immobility, they may also face an increased likelihood of complications like heart attack, pneumonia, and stroke.